Sciatica is a condition that manifests as pain along the sciatic nerve, which spans from the lower back through the hips and down each leg. The sciatic nerve is the longest nerve in the body, and when it becomes irritated or compressed, it leads to the symptoms associated with sciatica. Causes: herniated discs, when the soft inner material of a spinal disc protrudes and presses on the nerve roots. Spinal stenosis, narrowing of the spinal canal, putting pressure on the nerves. Degenerative disc disease, wear and tear on spinal discs, causing pain and irritation. Inflammation or injury. Conditions like spondylitis or injuries to the spine can contribute. Symptoms: pain. Pain ranges from a mild ache to a sharp, shooting sensation. Numbness and tingling. Numbness and tingling along the sciatic nerve pathway, often extending to the foot. Muscle weakness. Muscle weakness is seen especially in the affected leg. Worsened pain. There is worsening of pain, especially at standing, sitting, or coughing. Treatment: rest and activity modification. Rest. Adequate rest allows the body to recover. Avoid activities that exacerbate symptoms. Activity modification. Adjust posture and movements to minimize stress on the sciatic nerve. Physical therapy. Stretching exercises. Targeted stretches can alleviate muscle tension and improve flexibility. Strengthening exercises. Focus on core and back muscles to provide better support for the spine. Posture education. Learning and practicing proper posture can help prevent future episodes. Medications. Pain relievers. Over-the-counter options like ibuprofen or prescribed medications can alleviate pain and reduce inflammation. Muscle relaxant. These may be prescribed to ease muscle spasms. Heat and cold therapy. Heat packs. Heat packs are applied to the affected area, can help relax muscles and soothe pain. Cold compresses. Reduce inflammation and numb the area, providing relief from pain. Epidural steroid injections. Procedure: injections of corticosteroids directly into the affected area to reduce inflammation and relieves pain. It often provides temporary relief, and multiple injections may be needed. Surgery. Microdiscectomy. In cases of a herniated disc, the surgeon removes a small portion of the disc to relieve pressure on the nerve. Laminectomy. Enlarging the spinal canal to alleviate pressure on the nerve roots. Fusion. If instability is an issue, fusion surgery may be considered. Lifestyle modifications. Weight management. Excess weight can strain the lower back, contributing to sciatica. Proper lifting techniques. Avoiding lifting heavy objects improperly to prevent further injury. Complementary therapies. Acupuncture. Acupuncture is old Chinese pain management therapy. Some people find relief through acupuncture sessions. Chiropractic care. Spinal adjustments by a chiropractor may help in some cases. It's crucial to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan, as the effectiveness of treatments can vary based on the specific underlying cause of sciatica.